Oh, hey there, this is Dr. Evan Osar with Integrative Movement Institute. Welcome to this edition of Integrative Movement Insider. Happy Monday. Hope you had a great weekend. Hope your week has started out well. As we've been discussing here in this series of Integrative Movement Insider, we're discussing how we look at the fundamental movement patterns. So, pushing, pulling, squatting, lunging, rotation, walking, how we address those patterns, bending as well, how we address these fundamental movement patterns in our clients, especially the older population, in clients that are relatively deconditioned or on the lower end of the spectrum of the movement spectrum as far as like their expertise in exercise and movement. Actually, this applies to our athletes as well. So one of the things that we discussed in the last edition are pushing and pulling patterns. The position of the shoulders relative, the shoulder complex relative to the thoracolpelvic cylinder, so the rib cage over top of the pelvis. In the next edition of this series, we're discussing walking. So today is a great transition between the shoulders and what we're going to discuss in balance and walking, because the shoulder muscles are actually instrumental in helping to create and maintain optimal rotation. And I'm going to share with you exactly how that is so you can use these patterns with your older adults and really improve their ability to use their shoulders more effectively, use their shoulders as spinal rotators, and ultimately improve the efficiency of their walking because we know that walking is linked to longevity. Walking is linked to independence. Walking is linked to the thing that your client needs to do the most in everyday life because when they stop walking, they're going to lose a large level of quality of life or a lot of their quality of life, and they're going to lose their independence and become very dependent on other people. So, without further ado, here's an elastic band. And you've seen these sort of illustrations before, so I just wanted to briefly describe it. When we think about the shoulder complex, we talk about the shoulder complex quite a bit here. We have a great series of Two Anatomy Geeks on the shoulder complex. However, in the greater context of looking at the shoulder complex, we have to think about the shoulder complex and how it relates to the thoracolpelvic cylinder. Hence the reason we always start with the thoracolpelvic cylinder because that is the foundation for the shoulder complex. Most of the major muscles that move the shoulder complex, pecs, the trapezius, the rhomboids, the lats, they all have spinal attachments. They attach from the spine to the scapula and or the shoulder complexes specifically. We have the lats that attaches to the pelvis, to the lower lumbar spine, to the thoracic spine, to the thoracolumbar fascia. It wraps around to attach into the humerus. The pecs come from the rib cage itself, so even though it's not directly inserting into the spine, it's directly inserting or attaching to the rib cage and attaching into the humerus, with the front side of the humerus. So it's going to help to rotate the shoulder complex. So all these muscles are shoulder muscles, prime movers of the shoulder complex. However, what they also do, because of the attachment to the spine, they can actually help, or they not actually, they do help. They don't actually help. They do help create spinal rotation. And this is one of the major things that the majority of the industry doesn't train appropriately. Because when we think of like a lot of our shoulder exercises, they're done seated. Shoulder press, chest press, we'll do rows, things like that. We'll even do bent over rows. We'll do bilateral patterns. Very rarely, even when we have our clients do unilateral type work, they're usually just standing here like this, doing unilateral pushing or pulling. So again, there's control of rotation, but there's not actually specifically rotation happening in these patterns. And the other arm is just kind of dangling there doing nothing. So if you notice in many of our patterns, what we do with our clients is we want to get reciprocal action of the shoulders. Because when we have one arm reaching, essentially that's pushing. We have one arm pulling. Or going back or extending. So that's one arm's flexing and reaching out. And you have one arm extending and essentially reaching back. So we have this reciprocal action of the arms, which helps through these myofascial chains. So the anterior oblique chain attaching from the serratus anterior, the external obliques, to the opposite internal obliques and adductors and down the leg. We have this anterior oblique chain. We have a posterior oblique chain that goes from the lats to the contralateral glutes and across the thoracolumbar fascia and then down the leg. We have these myofascial chains that help to connect across the thoracolpelvic cylinder and then we're able to use the arms to help drive spinal rotation. And this is another reason why so many of our clients, or especially our older clients, you see it manifested in this sort of weeble wobble type of walking gait because they've lost the ability to use the limbs effectively to help rotate and maintain rotation. And that's when you lose that ability, you lose a lot of the efficiency of walking because it's really what you're trying to do when you're walking, or what the goal is here is you're winding up these myofascial chains so that once you get walking, it's a very efficient, energy efficient process. You're not using a lot of muscle effort. The more your client loses rotation, the more they start walking through this frontal plane, they're using a lot of effort. They're using effort to move their body from this side to this side, then control this side, and then go to this side. That's a lot of energy expenditure and a lot of wear and tear on the spine as well as the joints of the lower extremity to control that frontal plane motion versus when you're rotating and you wind up the myofascial chains, it's just like this rubber band. You're winding up the elastic potential in this connective tissue and then releasing it. Winding it up, releasing it. It requires very little effort once you're very efficient at using the myofascial chains. So here's how we train that function in our clients. So we love to do push-pull type patterns. Now, if you only have one cable setup, no problem, or one band, no problem. You're still going to use the opposite arm. So I'll use a pull with my right arm, and I'll use my left arm to create a pushing motion. So I'm going to set up with my left leg forward. I've got the cable in my right arm. I'm going to pull with my right arm and then reach with my left arm. So in this manner, I've got one arm reaching, pushing, one arm extending, pulling. So I can get this reciprocating action. And what that does is it helps to introduce a little bit of spinal rotation. Again, you don't need much. You're not trying to wind up a lawnmower. The old-fashioned lawnmowers, not the ones with the key start anymore, or the push button start. You're not trying to wind it up. You're trying to teach your client how to control the thoracolpelvic cylinder as they reach and as they pull. Reach and as they pull. And you see just this natural motion of my arms creates a little bit of spinal rotation. Now, again, we've already taught our clients how to align their thoracolpelvic cylinder to the best of their ability. So again, this is just a natural progression of that. If I had a band or another cable set up that direction, I could use a reciprocating pattern where now I'm pulling on one side, pushing on the other, pulling on one side, pushing on the other. And then I can get a little bit of spinal rotation into that motion as well. And now I'm teaching the oblique chains, the anterior and posterior oblique chains, how to create that spinal rotation. It's one of the best patterns that we've found and most successful patterns that we found to help our clients really train rotation in a safe and effective manner that actually translates over to more efficient walking. And then if you're using just a pushing pattern, you want to have your client, again, same idea. Don't just dangle this arm out here and just do this pushing. Get it active. So we have that client bring their shoulder up into this position. And if a client has shoulder issues, they can't get up here, they can stay down low, stay down low. So we have our client pulling with the left arm and pushing with the right arm. So the left arm is extending and pulling. The right arm is flexing and pushing. So again, we have this reciprocal action. So now both arms are involved in spinal rotation. And almost every single client can do some version of this pattern, even if they are seated and they can't get out of their chair. So maybe they're wheelchair bound or seated. They don't have great standing balance. This is a great pattern to do. And if they're upright in a split stance position, it's a great pattern to introduce and use its shoulder muscles, incorporate all the core muscles, and really train that reciprocating action of the upper extremities. So you're creating natural motion of the upper torso and through the limbs. And the more that you can incorporate, so for your more advanced clients, it's just the same idea. You can have them step and press out, step and press out. It's really the same idea. Or you're going to step and pull and rotate, step and pull and rotate. So it's again using the whole dynamic myofascial system, the whole kinetic chain, so to speak, in these motions. So it becomes more effective at training the oblique chains, training the fascial connections, and using the shoulder complex, those pushing and pulling patterns, to help drive and maintain spinal rotation. And you'll help so many of your older clients with their balance, because again, balance is just a dynamic aspect of control of the thoracolpelvic cylinder and the ability to rotate. You'll help them with walking. And again, you'll help them achieve so many of their activities of everyday life because we know our clients need to be walking more. They need to be more physically active. They need better rotation for better function in everyday life. And this is an easy way to incorporate that into your training program. And like I said, it's tolerated well by most individuals, especially when you set them up, or should say, it's most effective when you set them up appropriately and you don't just start with these patterns. You've progressed your client into these patterns so they understand where their thoracopelvic cylinder needs to be aligned. They've worked on their breathing, they've worked on their alignment, they understand how to push and pull, and then you incorporate it into these motions and you'll see pretty dramatic changes. I've been working with a woman with significant scoliosis for 1 week. 1 week. She had a trainer for the last 3 or 4 months. We've worked together 1 week and using some of these concepts. And she's like, already I notice I don't have that back tension anymore. I always get this knot in my right side because she's collapsed like this and her shoulder is pulled back on that side. She's got very significant scoliosis and she's already noticing a change where she's actually aligning better. And she's like, I don't feel that tension during work when I'm working on my mouse. So she's an accountant. She's on a computer all day long. So just using these patterns helps your clients with scoliosis. We'll talk more about that in the future as well. So I hope that makes sense. I hope that helped you. It helped think about how you can use pushing and pulling patterns to help drive spinal rotation in a safe and effective manner, help your older clients, help all clients that need to walk and or run more efficiently, which is most of our clients. And if you have any questions, feel free to leave them below this post here. I'll be happy to answer them. Thanks so much for being part of our community. I forgot to say that in the beginning. Thanks for allowing us to share this information with you so you can educate and empower your clients and enroll more individuals that need, want, and will pay you for your expertise. Until next time, this is Dr. Evan Osar with Integrative Movement Institute. We'll see you soon. Take care.